Hey y'all, what's up? It's your girl EB back in the building with another video. No, let me stop being silly. But okay. So I am coming to you guys to record another video. So this video is basically, I want to talk about becoming a medical assistant. For anybody out there that's interested in a career change, or if you're just jumping your career off and you don't really know what you want to do, I'm going to talk to you guys about what it entails to be a medical assistant, what your responsibilities are, and how you need to become a medical assistant, what you need to do to become a medical assistant. Anybody could be a medical assistant. I'm a medical assistant. I've been a medical assistant since I was, I don't know, in my early to mid 20s. I've been doing it for a long time now, 13 years. And it's a very rewarding career. There's a lot of room to grow. You can use it as a stepping stone if you want to start as a medical assistant and advance your career by getting additional education. You could do that as well. So there's just endless, there's a lot of opportunity in this field. Whatever you decide to do, if you have not already taken the steps to complete a program, because you do have to go through a program and get registered and or certified, depending on what state you live in. You could do both, but we'll talk about that later in another video. We'll stick with the main beginning things first. So we'll start there first. So, because that will be down the line after you complete a program. Whatever program you get into, make sure it's an accredited program. So no matter where you go, just make sure it's accredited. I myself particularly, I am a instructor. I'm a medical assistant instructor, and I work for Ross Medical Education Center. And basically, there are Ross schools in multiple states. There's in so many different states. Even if the state that you live in does not have a Ross school education center, there's so many different. This is a very growing and popular field to be in. So anywhere you are at, somebody is going to teach this. Even colleges teaches this program. The only thing about going to an actual college rather than like an education center or like a trade school is they're more expensive, and you're going to be in school for a lot longer time. With the school, for example, the school that I work in, it is an accelerated program. So you cram a lot of information into a shorter amount of time. So some of the schools that do that is Everest, I think it's called Education Center. Dorsey is another one. Career Quest, and then Ross Education Center that I work for. I'm sure there's a lot of other ones out there, but you would have to do your research to see what other accelerated programs exist out there. But like I said, you can go to your community colleges and learn this as well. But the only thing with that, you're going to be paying a lot more money, and you're going to be going to school for twice the amount of time. So I'm going to just start out talking about what it is to be a medical assistant. What are your responsibilities? What does being a medical assistant entail? So basically what being a medical assistant is a lot of people compare us to nurses. We do a lot of things that nurses are able to do. There's a good amount of stuff that we are not, it's out of our scope of practice. Also, that nurses can do things that we can't do, that we're not required or allowed to do because we don't have the proper training. But a lot of people are changing over to a lot of offices, doctors' offices, and surgery centers and things like that are utilizing medical assistants as opposed to nurses. And I'll probably end up doing a separate video on pros and cons, being a nurse versus being a medical assistant, and just the pros and cons of being a medical assistant overall. But we'll stick to the basics on this video. So basically, so the details, that's what I was going to talk about. I'm sorry. I sometimes lose my train of thought. Sorry. But so the details, being a medical assistant, what you're going to be responsible for is you're going to be responsible, depending on what type of office you work at. There's so many different options out there. You can work for a gynecologist. You can work for a family doctor. You can work for a surgeon. You can work for a rheumatologist who deals with arthritis. You can work for an ophthalmologist, deals with the eyes. You can work for a neurologist, deals with nerves. You can work for an orthopedic doctor dealing with the bones. There's a lot of different doctors that you can work for out there being a medical assistant. Whatever program you decide to go to, they are going to teach you, you're going to be well-rounded. They're going to teach you how to work with any type of doctor, any type of setting. You can work in a hospital if you want to. But with that being said, usually our responsibilities are rooming patients. You know, you get the patients back, you call them obviously from the exam room, you bring them back, you get their height, their weight, their vitals. You're going to be doing blood pressures, pulse, respirations, things like that. So once you get the patient inside the room and you've already taken their vitals, you're going to get a history for them, letting the doctor know why they are there in the office for that particular reason. It's either called a chief complaint or reason for visit is another word used to describe this. So you just want to get a basic reason for why they're there. So before the doctor goes in, they can have a brief, concise understanding as why they're going to be seeing this patient. So you're going to be asking them, okay, what brings you into the office today? Or usually when they schedule the appointment for the office visit, whoever the receptionist is going to have that on the schedule. Okay, Donna Johnson is here today for a headache. So that is going to be on the schedule. So even before you call the patient from the exam room, you're going to know that she's there because she has a headache. So when after you do your vitals and all that and you get them into the room, then you're going to basically, okay, I understand you're here, you have a headache. How long has this been going on? When did the headache start? Is it the front, the back, the side of the head? Have you taken any medications to help with this headache? Those are the types of questions you're going to be asking. And then the doctor would go in and see them and treat them. And the doctor might come back out after they go in and see the patient and say, okay, Donna is here for a headache. We want to give her a shot of Toradol. And that is an injection. And a Toradol injection helps minimize pain. It's a temporary relief for pain, but if somebody's in severe pain, you want to try to get that pain minimized as quickly as possible, just for their comfort. So then you, as a medical assistant, will be trained to go and administer that injection to that patient. You might be administering vaccines. You might be administering pain medicine. You might be administering steroid injections. You might be doing an EKG for a patient that might come in with some chest pain or palpitations. We also do EKGs as part of a regular physical exam. So you might be doing that. If a patient comes in with asthma issues, breathing issues, bronchitis, you might be administering a breathing treatment for that patient. You might be assisting the doctor in surgical procedures. As a medical assistant, we usually assist in minor procedures, no major surgeries. Usually we're not trained in depth to assist in major surgeries. So usually that's out of our scope of practice. So any minor, if a patient has a mole and they need a mole removed from their arm, or a skin lesion, or a cyst drained, called an incision and drainage, where they cut make an incision in the skin to get the pocket or the cyst structure out. And then sometimes the patients have to come back after a week after getting a certain procedure, and they might have to have their sutures or stitches removed. As a medical assistant, we do not apply sutures or stitches, but we do remove them. We do remove the sutures or the stitches. But like I said, it's usually not it's the doctor's or the physician's assistant or whomever. Usually that's their responsibility to apply the stitches. What else do we do? Oh my God, there's just so many things. We schedule appointments for patients. If you have a patient that comes in, for example, the patient that we had a headache, just using for an example, maybe you gave her a shot to ease the pain temporarily, but we need to know why she's having these headaches. So you might schedule an MRI of the head for this patient. So you would get on the phone with whatever hospital is in your area and schedule an MRI for this patient. Maybe we want to refer her to a neurologist that deals with headaches. You might be calling another doctor's office saying, hey, this patient is having these particular symptoms, and you send over her office notes and things like that, trying to get her in to be further evaluated to figure out why this patient is having these headaches. Because people get headaches for different reasons, but sometimes, for example, if it's something that's ongoing or something becoming severe, it could be a major health condition going on, or an underlying reason why he or she or whomever is getting these headaches. So things like that. There's just so many different things, like, you guys, like, there's a lot. Let's see, you might work in the front. Maybe you are the one that check patients in to check their insurance. Maybe you're the one that is answering the phones, taking calls, triaging patients, figuring out what they're calling for, answering their questions. If you're not able to answer the question, then you take a message and send it to the doctor, and then the medical assistant usually is the one responsible for calling, because the doctors are not calling the patients back. When patients are calling the office, for example, if a patient was seen earlier that day for an asthma issue, and the doctor prescribed a medicine for them, and they went to the pharmacy to pick up their medicine, and the script wasn't there like it should be. Mostly everything is done electronically now. So usually with prescriptions and things like that, is sent over electronically in your electronic health records, EHR. So we all know technology doesn't work how it's supposed to all the time. So it happens very frequently, not frequently, but enough, where a doctor sends the prescription electronically, and for whatever reason, there's a glitch in the system. It doesn't make it to the pharmacy, and the patient is there, and the pharmacy is like, oh, we don't have anything on file for you. So in that case, the patient will call the office back, and somebody, a front staff person, a front administrative person, would answer the phone, get the patient's on the patient on the other end, see why they're calling, and then kind of go from there. So if the patient is like, okay, my script isn't here, then the medical assistant or the front staff person would take that message and send it to the doctor and say, hey, this script never got received at the pharmacy. We need to call it in again, or how would you like to handle the situation? And usually it is our responsibility as the medical assistant to follow up with that patient after the doctor has answered that message. Whether it be, oh, we need you to come back into the office, or we need to call in a new script, or the situation or the issue has been taken care of, and now your script is for sure at the pharmacy. So, I mean, I could go on and on as far as what our responsibilities are as a medical assistant. Usually, whatever office you work in, you're gonna be like, each office is different. Some offices utilizes their medical assistants differently than other offices do. Sometimes you have more responsibility. You might have less responsibility, but these are just overall giving you a example of what you could be responsible for. You might be responsible for checking patients out, taking payments. You might be responsible for checking insurances, making copies of the cards. You're going to have a list of tasks that you are going to be responsible for. But like I said, it's a very important job, and that's what makes it rewarding. You're helping people. It's just so many different things, you guys, about being a medical assistant. So with that being said, those are some of the responsibilities that you would have. I might have to do a part 2 to this and maybe make a list of things that you would be responsible for. If you guys have any other questions, feel free to leave comments below and I will definitely answer the questions. But to become a medical assistant, like I said, you have to complete a program either at a college, like a community college, or some type of medical education center. Most programs, the accelerated programs, like the where I work, where I teach, it is the program is 9 months. It's a 9-month program. Okay, so you're coming to class 4 days a week for about 9 months. And then you go on an externship for 6 weeks, which is a month and a half after you've completed your 9-month course. Everything is hands-on. So you're learning injection hands-on. Anything that we do, you're doing it hands-on. Once you get out into the field and you start working for a doctor's office, well, not working for, so first you're going to be doing, like I said, you're going to be doing your externship where you're working in a doctor's office with real patients hands-on. Because anything you do in class, you and this other students, you guys are going to be practicing on each other. Blood draws is another thing that we do, which is phlebotomy. So that is part of being a medical assistant. But once you get out there, you're going to be learning, practicing on actual patients. You are doing the work for free, and usually you're doing it, but not free because you're getting something out of it. You're getting the training that you need out of it and getting the exposure that you need. So, it's free, but it's not free, in a sense. So, but with that being said, you do that. And then once you graduate that, you go and sit for the state test, whatever state you're in, either the registered test or the certification test. And that way, you don't have to sit for the test, but you will make a lot more money. Trust me, you will make a lot more money if you are registered or certified as a medical assistant. If you take all that time to complete the program and you don't go get certified, it's just not beneficial to you to not be certified. It's more advantageous for you in your career to go get certified. It just validates that you know what you're doing. But like I said, I'll probably do a different video for the pros and cons, what a medical assistant can do and what a nurse can do, the differences between the two, because again, a lot of people do compare the two because we have a lot of the same responsibilities. But I like I said, I'll go over that in a different video. So you guys, like I said, I don't want this video to be too long. Any other questions? I'm going to do some more videos also on becoming a medical assistant and being in just different things. On maybe you're already a medical assistant. Maybe you want to get into instructing because that's what I did. I'm going to do a video on that. So just stay tuned. Hit the notification button, rate, comment, and subscribe. Because like I said, I'm going to be coming at you guys with a lot of different videos in this field and talking about CPR, becoming a CPR instructor, and just so many different things, you guys. I have a lot of plans for my channel and a lot of content to cover. So, like I said, my other videos used to be more toward like beauty, makeup, hair, and things like that, but I'm kind of changing it a little bit. I want to do more inspirational things and giving people knowledge that they need on different things and have you guys follow my journey. Like I said before, my journey is, have been put on hold with the whole COVID-19 situation. And all the plans and the goals that I have for myself as far as my career, because like I said, I've been doing medical assisting for 13 years. I've been a medical assistant instructor. I've been teaching medical assistant for 2 years. And now I want to endeavor in being an office manager and also being a CPR instructor. So anyways, you guys, I am going to make this video, I'm going to end it here because I don't want it to be too long. There is more to cover, but this is good for now. So anyways, rate, comment, and subscribe. When I have more people viewing my videos and knowing that my content is helping somebody, that is going to keep me consistent, you guys, and keep me bringing forth information that you guys may need. So anyways, deuces.